And we begin with breaking news. The Idaho Department of Health and Welfare activated crisis standards of care in northern Idaho because of a surge in COVID patients who need hospital care and a severe shortage of staff and available beds. Now, this impacts the Panhandle and North Central health districts. So what does this mean? When crisis standards of care are in effect, people who need medical care may experience care that is different from what they expect. For example, patients admitted to the hospital may find the hospital beds, staff, and needed equipment are not available. In the most extreme supply shortages, resources may be allocated to patients with cases more likely to have a positive outcome. It's also possible that non-urgent or less urgent care may not be provided in order to ensure timely response to the most severe life or death emergencies. And this is truly a last resort and something the state did not want to see happen.
A declaration that covers two health districts, the Panhandle and North Central. And there are lots of questions as to how, why now, what's next, that Joe Paris will hopefully be able to answer for us. Joe, and I know major question right now is about the rest of the state, other regions other than North Idaho. How close to crisis are they?
Well, the short answer is that they're very close, but they're not in crisis standards of care outside of North Idaho right now. It's very important to note that this is just one section of the state and that the Department of Health and Welfare and the medical communities, they're really able to do this tailored by region, and that's why we're seeing this. Now, activating crisis standards of care in other parts of the state, like the Treasure Valley, that was on the table in recent days when the State of Idaho Disaster Medical Advisory Committee met. Now, Health and Welfare Director Dave Jepson gave some insight a short time ago about the conversation he and the committee had about activating the crisis standards of care.
That it was appropriate for the North Idaho area, and it's a pretty serious thing to declare crisis standards of care. It's something that none of us do lightly and take very seriously. And at the end of the day, we felt like we had just a little bit of wiggle room left in the rest of the state, but I want to emphasize not much.
So it's a bad situation right now, and the question, Brian, is how long do these crisis standards last? And long story short, this is not a one-day or a two-day thing. It's possible that we could jump in and out of it.
All right, Bill texted in and wanted to know what hospitals in North Idaho are affected by this crisis standards. Benawa Community Hospital, Bonner, Boundary, Kootenai Health, Shoshone Medical Center, that's in the Panhandle District. Clearwater, Gritman, St. Joseph, St. Mary's, and Syringa hospitals are all included in that. That's 10 all told. Why are we not hearing about statistics regarding adverse effects, if any, with getting the virus? I'll tell you this. Kootenai Health on their website says none of their COVID patients in the hospital are there for adverse effects. Zero, none, and that pretty much extends over the entire health system. Not vaccinated? If you get sick, stay home and deal with it. Give our heroes a break. This one is, you're showing COVID every day. Too much, says Georgette. Georgette, we're in crisis standards of care right now.
Good afternoon. We begin today with something Idaho medical leaders are calling dire. We are talking about our healthcare system, which has become overwhelmed of late by the virus. We have team coverage this afternoon as we continue to follow breaking news. The entire state of Idaho now under crisis standards of care. This comes about as hospitals and ICUs all around the Gem State are filling up very rapidly with very sick people fighting a battle with COVID. The state's healthcare managers weighed in on the status of the system today and what's happening right now and what needs to happen next. Our Joe Paris listened in on what they had to say and joins us now in the studio with that. Joe.
Well, Mark, we're in a crisis, plain and simple. This morning, St. Luke's Health System formally requested to go into crisis standards, and soon after, the Idaho Department of Health and Welfare announced that they were activating those crisis standards of care.
Joe, a lot of people are having trouble wrapping their head around exactly what this means, and they want to bottom line this. Say you fall off a ladder, cleaning your gutters, you break a collarbone, you go to the ER. Is there a chance that you will not be seen and treated because of what's going on right now?
At this point, Mark, in the Treasure Valley, we know that if a situation like you just described happened, there's a really good chance that someone may have to be waiting in pain without treatment until there's simply enough resources or space to deal with them. What they try to do is they try to really order this, and they really try to prioritize the care based on the document the state has put out, saying that sometimes there is prioritization of care based upon a whole set of different requirements. Long story short, though, and to sum this up, if you're needing urgent care, there may not be enough resources to treat you at this point. So you need to be careful. They're calling on the community to do what they can about COVID, mask up, get vaccinated, etc., but also asking people in the community to be safe with things like extreme sports.
It's so sad that we're asking our medical staffs to prioritize worst case scenarios and give everyone a ladder on who is in need of care the most. That is really, really sad. All right, Joe, thank you. With more now on how this will impact Idahoans in their day-to-day life, we turn to our Andrew Bartline. He has been on the streets of Boise today, getting the pulse, if you will, of Idahoans. Andrew, what's the overall take on this?
Yeah, Mark, it's really a wide net, the reactions and responses I've heard from people today. Some say that enacting crisis standards of care, they don't really expect it to impact them that much, whereas others are a lot more concerned. That second group that's more concerned, they really reference some mitigating measures that maybe they lost sight of. They're going to focus more toward that now. Masking up, avoiding large crowds. But this goes beyond COVID. It could be driving. So really mitigating any measure you can to stay out of the hospital and reduce your risk. Now, we spoke with one woman who says she's already seen how overrun the hospitals are, and because of that, she really wants to stay away.
Last night, I actually was at the St. Luke's ER in the evening with my mom, and now I'm wondering if our experience is a reflection that there was some delay in our care and our discharge. We were there for longer than we expected.
There are a lot of things that people could do to hopefully stay out of the ER and out of the hospitals in general.
I've had both vaccines, and I stay out of crowds. I wear my mask if I'm inside, that's all I can do.
I've been vaccinated, and I'm going to live my life. You know, with a few precautions here and there. Maybe I'll wear a mask here and there, but I'm not going to go hide in the basement either.
Now, as you just heard, not everyone feels the same way about this. Those who aren't overly concerned are pointing toward the perceived risks we face every day. Brought up driving a car, you could get in a wreck. And as we saw with that last man riding a bike, he says he's not going to stop riding his bike. So, of course, it's always a good idea to stay out of the hospital. The folks we talked about today, range of concerns, but nobody tells us they're making any big lifestyle changes. Those who are more concerned are just saying they're being a little more mindful. Mark?
It's first ever situation for the healthcare system in our state and for all of us. We're still trying to figure out the navigation through this.
In recent months, weeks, and days, we've watched the Delta variant cause a surge to the like of which we had not seen here in the state. Then we watched part of the state going to crisis standards of care, and then a week ago, the entire state of Idaho going to operating under critical conditions. And even that dire declaration hasn't seemed to slow the outbreak or devastation that COVID is having on our healthcare systems and our community. As of Monday, 760 people are in Idaho's hospitals with COVID. 202 are in the ICU. Both of those are record highs. And those numbers are likely higher, as not all hospitals have submitted their data yet this week. Now, these numbers we have told you over and over again, and we're going to continue to tell you about them, even though we may sound like a broken record. But why do we continue to tell you this? Well, we can't stress this enough. We are in a dire situation, and that continues to be a daily reality for our healthcare professionals and our healthcare system. But for the first time, we're seeing what it's like inside of our hospitals with a firsthand experience. Ryan Holmes and photojournalist Kevin Esslinger were able to go inside the intensive care unit at St. Alphonsus in Boise this morning. Brian, how would you describe the scene inside St. Alphonsus?
Well, Joe, it was very powerful, to say the least. Tens of thousands pass by St. Alphonsus Regional Medical Center every day. 9 stories high, it's the largest building for miles, making it hard to miss. But it may be easy for the outside world to ignore what's going on inside. Let's start on the 3rd floor.
This is the main intensive care unit. We've got 22 beds in this unit. The majority of the patients in this unit are COVID positive.
20 of which, Dr. McInerney tells us, are intubated, breathing only by way of a machine. But these days, these 22 ICU beds aren't enough.
And in the unit next door is a 10-bed ICU, and every single patient in that ICU is COVID positive right now.
And 9 of them are also on ventilators. Some have been for weeks. And none of the ICU COVID patients are vaccinated against the disease, according to the doctors. The third floor is at full capacity.
We have 4 ICU doctors on today during the day. We would usually have 2.
Which is why 2 floors below and in a separate section of St. Alphonsus, a surgical recovery room has been turned into another ICU. 8 more beds they expect will soon see their first critically ill patients. But before they get here, they usually start here in the emergency department.
This is our main core. This is the trauma centers.
And being the only trauma center in the region, they can get pretty busy, even without a pandemic.
We've got all of our nursing and techs and 2 physicians and 2 PAs on right now to see patients. And they're being triaged in the front. Also, ambulances coming in. We just had a helicopter land. So it's starting to pick up.
Dr. Andrew Southard is the emergency medical director. He says they typically see about 130 patients a day, 13 of which, on average, are fighting off the coronavirus and not doing it very well.
Of the COVID patients that we see, probably 50 to 60% of them are getting admitted to hospital right then.
Problem is, where do you put them?
So before the COVID surge, we had a goal of 120 minutes before we decided they need to be admitted till they were upstairs on the floor. Most times we were able to meet that. Oftentimes it'd be within 60 minutes. So that's our goal. We are not meeting that goal anywhere close at this point.
What is it now?
I would say on average we're 4 to 5 hours at this point on a good day. On a bad day, we're looking, again, 16 hours or so sometimes down here.
So like every other unit at St. Alphonsus, they've had to create more space.
So this was previously we had all of our equipment storage in here. We used to keep all of our oxygen, splints, supplies in here, and now this is a 6-bed treatment area for patients. So it works pretty well. It's a little tight, but better than sitting outside in the waiting room.
And that means their conference room became the storage room.
Yeah, 6 months ago, this is where we did education and conferences. It was a nice conference room, but we don't do that anymore in here. And that's kind of exactly what the ER is. You just kind of do what you got to do.
One of a list of many things they've had to adjust under this COVID crush.
What do you say to people who say, y'all should have been ready for this? You should have expected this. You should have been prepared.
Yeah. You can never be prepared for everything. We train for disasters all the time. We've trained for chemical disasters and biological warfare. But when you're talking about a sustained momentum of months or a year and a half now, I don't think anyone can actually prepare for it.
The reaction mentally for his staff has been just as much of an adjustment.
The ER, I think, is the most resistant place in the hospital. We're used to seeing bad things happen to good people, but I think what is the hardest thing right now for the staff is knowing that we're basically watching people get ill and die of a preventable disease.
Meanwhile, in another area of the hospital, the 9th floor of the central tower is usually dedicated to joint replacement and rehab.
Normally we wouldn't have beds in here. This is a gym for physical therapy. However, at this point it's been repurposed as a COVID unit for overflow.
It actually had COVID patients in it earlier this week, adding to the 32 already on this floor.
Fortunately, we had some discharges. Unfortunately, we also had 5 deaths within our hospital here. And so we have the space available today.
The 9th isn't the only converted COVID floor.
The 5 central floor was also an orthopedic floor, now exclusively dedicated to COVID care. There's 32 beds down there.
Some of which rely on bells, an old school way to ring for help. 2 dedicated floors with overflow rooms. And it's still not enough to keep up with increasing coronavirus cases.
Equally alarming that we're meeting records for both ICU care and just hospitalizations daily, that we're surpassing, just blasting through our records from December of 2020.
Does that shock you?
Not really. We just cracked 40% vaccination rate for the state. Life is normal now, right? So people have pandemic fatigue. People are not masking, they're not distancing, they're enjoying all the jubilation that fall brings with football games, festivals, concerts, back to school, of course. And so it does not surprise me that with business as normal, with all those activities, low vaccination rate, mask hesitancy, that we're seeing what we're seeing here inside the hospital.
All right, I guess I'm going to cut to the chase. Do you take that personally?
Do I take it personally? It saddens me, because I see these as preventable deaths. We have an effective vaccine, and bringing in the emotionality of taking it personally would only hinder that therapeutic relationship. But I know that it's weighing on all of our healthcare providers.
Providers like Carrie Smith.
Oh, thank you.
An RN who's in the middle of another 12-hour shift.
Okay.
That will likely go longer.
You'll do that 3 days in a row?
Yeah. At the end of the third day, you're pretty fatigued physically, but the mental part is maybe the harder part because you have been that person standing in for family members, sometimes being the last person that a patient will see in their life before they pass away.
Carrie says she can't count the times she's been that last person in the last 18 months.
Yesterday, I just wanted to yell because this could have potentially been avoided. This person had a lot of life left, did not have other health concerns.
That's where the emotional part comes in.
Yeah, and it's funny how you're able to figure out how you're gonna cope with that, but I will say that yesterday was extremely difficult. You take your 60 seconds in the med room, you cry, you clean up your tears the best you can, and then you go back in because you know that that family needs you to be there.
You swallow that.
Yeah, you have to. And you're thinking in your mind, I'm glad it's not me, that I'm losing my brother, my sister, my father. And you feel a certain level of guilt for that, that you're happy that it's not happening to you.
Yes, people do die on the COVID floor without ever making it to the third floor, the ICU, where for the third time this morning, a code blue has been called for a COVID patient. An alarm that calls medical staff from several units across St. Al's. And for nearly half an hour, all of their attention is attuned to this one room, working and hoping to bring someone back to life.
Watching you guys work, it was an emotional experience for me. How do you do this?
A couple of things. This is what I was trained to do. It's what we were all trained to do. It's not that the death doesn't affect us, right? We're not robots. We all tear up, go home and cry to our family members at various times. And then, I've said this before, you know, this is when you feel like you're doing this in the context of a team, and that idea that you're not alone doing this, that helps a little as well. Because you saw I wasn't alone in there. A bunch of people ran in to help.
They do this every time.
Oh yeah, it's daunting. And our team's struggling, right? There's this this moral distress that's happening amongst healthcare workers, amongst physicians, nurse practitioners, physician assistants, respiratory therapists, nurses, CNAs. All of us are feeling this extra weight of emotion and moral distress because so many of our patients are unvaccinated and dying because they chose not to get vaccinated.
Do you see the light at the end of the tunnel at all?
No.
You don't?
No. And that's heartbreaking for me to have to say. I did when I got my vaccine in December of 2020. That was my light at the end of the tunnel initially. But now I don't know where the end is. Will do this code blue have to console a family member, you know, because their loved one died from COVID, and then turn around and see that there's a big music festival, you know, downtown, that people are going to large gatherings and not wearing their masks, and I get it, people feel like they want to keep living their lives, and we're not asking people to put everything on hold indefinitely, but I mean, we're in the biggest surge that we've ever experienced. This is the first time that our state has declared crisis standards of care, and many people in the community are going about their lives as if there's nothing different going on.
What's it like to walk out of here every day?
Just, it feels heavy, right? Try and take some of the wins with you.
The wins are track 2 at the employee entrance, where everyone is reminded why they keep coming back.
There's been a lot of times that I just make it out to my car and it takes me 30 minutes to get the car started to head home. You feel like you want to give up, but then you rely on your coworkers to like give you strength because they understand what you're going through. And then you just like reset and you just come back and you do it again.
Carrie Smith, that nurse that we spoke with, she says it's a privilege to be in that room with a patient who is passing from COVID and to be there with their family. Because again, as she said, she knows that she is needed and that's where she needs to be. It matters because, as you heard, days like this can be pretty heavy. They can take their toll on the staff and the doctors, the nurses, everybody here at St. Alphonsus. Dr. McInerney told us that the hardest part coming to work isn't the physical toll, it isn't the emotional toll, it's worrying about whether or not you can have enough staff to care for all the patients that are here at the hospital. She is the ICU director, and that is her job, just one of her jobs, because she also makes rounds, and she also does everything else that comes with being in the ICU. And as I mentioned, it can be a heavy situation. 3 patients coded here at St. Alphonsus this morning while we were, well, not while we were here, one of them did while we were here. And it was impressive to see this staff respond the way that they did. Everybody focused on that room. The people that had to get in there got in there. There were no fewer than a dozen people working on this patient who was coding. What impressed me the most, Joe, I'll just leave you with this, is that the number of people that put their entire focus on that room at that time was impressive. There wasn't one person who wasn't occupied doing something else and caring for a patient that wasn't there willing to offer a hand, or at the very least, offer support for what was going on in that room. I thought I was ready for what I saw today, but we saw some stuff today, Joe, and it wasn't always pretty. But just know that the people inside this building and every one of these hospitals in the Treasure Valley and across the state are doing everything they can to not be in this situation. And every day we bring you these stories of how they're begging you to not put them in this situation. Some of them are unavoidable. We get that. They get that. But I don't know if we can say it enough, how much they really, really, really need help from outside these walls.
So Brian Holmes reporting from St. Alphonsus in Boise. Well, moving on about 2.5 hours to the east is Minidoka Memorial Hospital in Rupert, Idaho. The town, which is home to about 6,000 people, has just one ICU bed, just one. And as cases continue to go up, their small rural hospital is having to take on more and more patients. Now, this is a look we're going to show you right here at cases in Minidoka County. Their 7-day moving average, 57 cases, which isn't as high as it was back in the December surge, but you can see that they're continuing to increase and approaching that point. What this graph doesn't show is what their hospital system is seeing in terms of pressure. Katya Stepovic is live for us this evening in Rupert, just outside Minidoka Memorial. And Katya, we just heard from Brian about what he's seeing in St. Alphonsus in Boise. Describe to us what you're seeing in Minidoka.
Joe, I mean, Brian put it pretty bleak there, and there's not much more I can add, to be honest. The situation today we saw was really tough. We talk about these statistics and we talk about these numbers all the time, but it's one thing when you see these people fighting, battling, and losing this battle against COVID-19. And here at Minidoka Memorial, they had that added pressure of limited resources. They are a small hospital, and while they're not operating under crisis standards of care right now, they say that that can happen any day now. Now, Minidoka is a smaller hospital, and they've been taking patients from St. Luke's in Magic Valley, and they can only take patients if they're not tubed and do not require a ventilator because of limited resources. Every day, the emergency waiting room is flooded with people because they only have 7 ER beds and 1 ICU bed, just one single ICU bed, with only a couple COVID rooms left to take new patients. And like we have said time and time again, this hospital too is seeing the most COVID patients they have ever seen. They are more sick and they are dying.
It is scary because we've never had to do this before. And you know, every life matters to us.
Getting a lot of messages today showing support for our healthcare workers out there. We just wanted to end the show today sharing as many of those as we can, like this one here from Steve. Many years ago, I worked in a hospital. A patient coded on me. I quit. Can't imagine seeing that over and over again. God bless our healthcare workers. This one also sent in from Don in Caldwell. After watching today's segment on COVID, I just thought, wow, thank God for every branch of healthcare workers. I'm so sorry. So much is being asked of you and no end in sight. But know you are all in our prayers and we are eternally grateful. Continues on with many of these messages for today. Thank you so much for reporting on the reality we are experiencing. It is exhausting, sad, and relentless. I am a respiratory therapist at St. Luke's in Meridian, and you have our respect for what you do and keep showing up every single day. Thank you very much. Sad to hear the one doctor say she can't see the light at the end of the tunnel. That's Dr. McInerney, the medical director at the ICU at St. Alphonsus. They just keep seeing the same thing every day with the unvaccinated. That would be hard. God bless them all, says Patrick. Thank you for reporting on what our compassionate healthcare workers do each and every day. Only a hero could walk in their shoes, says Michelle and Haley. We couldn't agree more. It is something, a daunting task, as you heard Dr. McInerney say, that they do show up for every single day. And yes, that's where their biggest supply is. And there were times, even last week, where they were lacking in what they felt like support from their community. That's what felt like they were lacking for them. So it is, well, hopefully something that we can change course with and give them something to show that we support. Remember we were doing that at the beginning of this pandemic? They were our heroes for sure. And well, it doesn't seem like that for them now because it doesn't show that everybody's caring for each other when it comes to not following the rules, maybe not getting vaccinated and making their jobs and their lives a little bit tougher every single day. As a medical supplies delivery driver who delivers vaccines throughout the valley, I see what doctors and nurses go through. Please go get vaccinated, says Jim in Boise. Another person sent something in asking why we don't just say at the end of the 208, hey, go get your vaccine. We have medical experts that say that to you every single day and have, well, almost every single day. But every single time we talk to a medical expert in a hospital, they say that very thing. Do you really think that it would matter what we said to you versus somebody who has experience, a lot more experience than we do, telling you what's best in a pandemic? Probably not. But we appreciate the gesture and maybe the belief that we have that kind of pull. I'm afraid we don't, because if so, we probably wouldn't be in the position that we are in right now. Thanks for watching. We'll see you back here tomorrow.